Hello everyone, I hope all of you doing well. So today I'm talking about how we can deal with the hypertension. According to the PLABABLE James, I make these slides and it's very easy and just in 5 to 10 minutes we will cover all the topics of the hypertension. So how can we deal with hypertension if patient coming to us in a clinic? So how we approach for the hypertension patient? Firstly, we have to look that where we are and in what range the patient coming to us. If we are in a clinic and we check the BP of the patient and the measurement is coming in these two categories. The one, if the patient is coming and we check the BP and it's between the 140 to 90 up to 179 to 119, so we advise the patient ambulatory blood pressure monitoring. We look or we measure the 24-hour BP of the patient, and then we decide if is the patient hypertensive or not. If the hypertensive, so we will start antihypertensive medicines. Secondly, if the patient coming to you in a clinic and you check the BP and it's more than 180 systolic or more than 120 millimercury diastolic, so in that cases you have to look one extra things. What is that? It is emergency signs. If the patient look for retinal bleeding, is the patient has any bleeding, retinal bleeding or not? Is the patient has any bleeding, cranial bleeding or not? Like stroke, hemorrhagic stroke. Is the patient has any new confusion, chest pain, or heart failure, or acute kidney injury? You have to look for these signs. If the patient comes with this range and has one of this, what you can do is it is the emergency situation and you have to admit this patient and treat it in a hospital. And you can start IV labetalol. And you can proceed with more antihypertensive medicines. But if the patient comes with this range and doesn't have any of this sign, so what you can do, you can start antihypertensive medicines. Antihypertensive medicine. You are not waiting for the ABPM. In this range, we are not advised ABPM. We straight away prescribe antihypertensive medicine. So now if you advise to the patient ABPM and now he came to you with this range, this two range, so how you can deal with that? If the ABPM ambulatory blood pressure monitoring or the home blood pressure monitoring ranges in 135 to 85 up to 149 to 94 millimercury, this is a stage 1 hypertension. Stage 1 hypertension. And how you can deal with that? You can advise the to patient, advise to patient to change lifestyle. So you can deal with this range to advise to change the lifestyle. But if the patient come with this range, more than 150 systolic or more than 95 diastolic, so this is a stage 2 hypertension, and you have to start antihypertensive medicine. Antihypertensive medicine. How you choose antihypertensive medicines? It's depend on the patient situation. Let's see what is that situation. Look for the patient. Is the patient along with hypertension have diabetes or not? If the patient come to you with this range and he's non-diabetic, so you have to look for two more criteria. What is that? It's age and ethnicity. These two are important in hypertensive patient which is non-diabetic. So how? Let's see. If the patient age is less than 55 or the patient age is more than 55. So we deal with these two in different way. Let me to move that. So in that cases, if the patient age is less than 55, we deal differently. And if the patient age is more than 55, along with that, we're looking for ethnicity black African or African Caribbean. So in that two situation, we deal different. If the patient is the age is less than 55, we start our medicine from what? From ACE inhibitors or ARBs. You can choose either ACE or ARBs. So it doesn't matter. So we prefer ACEs, good option. If we prescribe ACE or ARBs and the baby is not controlled, what we can do, we can choose another medicines or we can add another medicines to one of them. That will be calcium channel blocker or thiazide. For example, I'm choosing AC inhibitors and choosing calcium channel blockers or AC inhibitors or thiazide. Look and monitor the patient. If not controlled with two of them, we can make a combination three of them, like ACE inhibitors or ARBs, choose one of them, plus calcium channel blocker plus thiazide. Let's to give you an example of this medicines. Like from AC, I'm choosing AC inhibitors. From AC inhibitors is enalapril. From calcium channel blocker, amlodipine. From thiazide, indapamide. or furosemide. So that is the end of the medicines for this patient. But if the patient age is more than 55 and is black, the patient is hypertensive, non-diabetic, how can you deal with that? You will start from calcium channel blocker, not from ACE or ARBs. Then, if not controlled with CCB, you can add ACE inhibitors or ARBs or thiazide. Sorry, let's write thiazide below. So you can choose calcium channel blockers with ARBs and or thiazide. So with calcium channel blocker, you can choose ACE, ARBs, or thiazide. I would like to emphasize again, choose for the black patient ARBs instead of the AC. If not controlled with the combination of the calcium channel blocker with ACE or ARBs or thiazide, then you can make a combination of three of them. What was three of them? Calcium channel blocker plus ACE or ARBs plus thiazide, which I wrote here. By this, you can deal with hypertensive patient, which is non-diabetic. We choose the criteria, age and ethnicity. Now come in here, if the patient is hypertensive and along with hypertensive, the patient has a diabetic condition. So in that situation, we are not looking for age and ethnicity. We are not looking for this. We directly start from ACE inhibitors or ARBs. I would like to emphasize again that choose in this patient, which is hypertensive and diabetic and black, you can choose ARBs instead of the AC. The rest patient, all of them, you can start from the AC inhibitors. Then, if not controlled, you can add the calcium channel blocker or thiazide. If not controlled, you can choose all of them. You can choose combination three of them. ACE inhibitors or ARBs plus CCB, calcium channel blocker, plus thiazide. So by the combination of these three, you can manage the hypertension of the patient. So that's all about the patient which has hypertension and how we approach for that. I hope you enjoy it from my videos. Thank you.